Welcome to another episode of Chill with Bill at San Antonio Zoo. Today I have with me Dr. Tom Gowan, and he is the chair of the pediatric department at Baptist Children's Hospital at North Central. And today we're at one of my favorite habitats. It's the giraffes. Did you know, Dr. Gowan, that a giraffe has the same number of bones in its neck that we do?
That's incredible.
Today we're going to talk about a serious subject, and that is RSV. So first off, Dr. Gowan, what is RSV?
Respiratory syncytial virus. It's a virus that's associated usually with winter times. When COVID came along, it kind of destroyed that regularity, and now it looks like it's back. We have quite a few cases of it right now, and it affects the small airways. It's actually called RSV bronchiolitis because it affects the small airways, the bronchioles, and makes young children very sick at times.
Now, can adults get RSV?
Yes, adults can get RSV, and there's actually a vaccine for adults. And that's one of the preventative measures in a family, especially if you have multi-generations, for the adults to get vaccinated. If you're over 60 years of age and have some risk factor, yes, the vaccine is recommended for older adults.
Now, if I had a child who got RSV, what kind of treatment?
Well, let's talk about it. It kind of depends on the age. RSV is particularly dangerous in children under 2 years of age, but mostly under 6 months. And those children that were born premature or have congenital heart problems at birth or immune issues, those are the ones that are at risk. I don't want to worry everybody because really the majority of children that get RSV do not get hospitalized. It's about 2% that get hospitalized, but those that are in the risk area, it can be high morbidity and mortality. Unfortunately, in the United States, about 200 to 300 children pass with RSV each season.
That's terrible. Is there a vaccine that children can take for RSV?
Well, let's talk about that. There's several preventative ways to prevent RSV through vaccination or immunization. The first one is those that are 60 years of age or older, and the other thing is pregnant women can be vaccinated for RSV between 32 and 36 weeks. What does that do? Well, the antibodies from pregnant women pass through the placenta to the child at time of birth. That actually protects a child for the first 6 months of life. So being proactive for women that are pregnant, discussing that with their obstetrician is one way. The other thing is that children that are premature or have chronic lung or were in the NICU and had to be on ventilation or special respiratory support, those children are at risk. They have an airway that might have a chronic chronicity to it, and those children and other children that may have a risk factor or are given injections of immunoglobulin. We say it's a vaccine, but it works a little bit different. But yes, those are ways that we can protect children from it.
Dr. Gowan, thank you for coming out today and spending a little time here at the giraffe habitat. All these birds and other animals in here as well. I love this place. But thank you for telling us a little bit about RSV and how you treat it.
My pleasure. It's been a lot of fun.